Breathe out, let it fall. Punch it. Breathe out, let it fall. 10 more seconds. All right, so today's another fantastic day in New York City. We got the snow outside. We got a busy schedule. Today's one of those days we're gonna be cracking a bunch of people. We got a whole schedule, about 50 people on it. Everyone needs to be cracked. We're gonna be using some flex power to kind of loosen up, do some muscle work, stretching, exercise, and stuff like that. And today, basically the biggest thing is get people out of that hunching mode, get them straightened out. It's snowy outside, but nice, warm in here. Come try it out. We're gonna be adjusting a lot of people.
We're starting.
Walk in the room. All right, so what's going on? Any pain, anything like that?
Yeah, actually. I'm sorry.
You're good.
I messed up my back a few weeks ago.
Okay, what'd you do?
I don't know. I couldn't move it up.
You're working out or just?
Yeah, I'm doing the 75 hard right now. So very little
Yeah,
rest.
for sure. I was about to say, no
And I
relaxing.
tweaked
Okay.
it and I couldn't move.
All right, where are you feeling pain? Is it low back, upper back?
Lower back, lower right.
Yeah. Has it stopped you from working out?
Yeah, I did for a while. I
Okay.
did nothing but walk.
Okay. How's it now?
It's good now. A little sore though, but still, it's
All right. Go in your stomach. Let's take a look.
okay.
Feel stiff, but not too crazy.
I'm trying to stretch like crazy.
Yeah. All right. I'm gonna use the Theragun first,
Okay.
and then we're gonna stretch out the back a bunch.
Actually, I always go back to your TikToks and look for the stretches to do.
It's the simple things, right? Yeah. Feel you twitching. You working out today?
Yeah, I haven't yet, but yeah, still putting 2 workouts.
Yeah. 2.
75 hard, that's crazy.
That sounds awful. Awful and awesome at the same time. So this table's gonna bend. I'm gonna stretch out your low back a little bit.
Okay.
I'm gonna roll up your shirt just a little bit.
Sure. Yeah, it seems like those tweaks just never go away, man, no matter how much I stretch.
Honestly, it's ridiculous common. Everyone has it.
Yeah.
Yeah.
Like at least 2 to 3 times a year, it just,
More than normal.
yeah.
So you're gonna feel a little bit of stretch here. Yeah, it's just happens when you just hunch a lot or whatever, just look compressed in the low back, sleep a little bit funky, these muscles get really tight. This is a good way to kind of decompress the spine. It's like we're just gapping joint by joint, open them up, gives the disc a little time to breathe. Alright. Any pain like this?
No.
Feel good?
Yeah.
I keep seeing your face on dental ads.
Yeah. Yeah, that was back in 2002.
Oh, really?
I guess they
What?
just started using them.
Yeah.
Yeah, from 10.
Yeah. So anytime I notice I'm overdue with a dentist, see your face. Alright. It's been a little bit. I'm going to remind you of the motion, okay? We're going to bend this top leg. These arms. Relax. So you're just going to let this leg drop, okay? Take a deep breath for me. Breathe out. Let it fall. Punch it. Other side, please. Some diesel boots.
Day 4.
Yeah, I went to walk the gym this morning in normal sneakers, and my sneakers are absolutely soaked today. Deep breath. Breathe out. Let it go. Not so bad. Lay on your back, please. Alright. Let's see. So I'm just going to remind you. We'll be here.
What's that?
I'm just going to remind you of the motion.
Okay.
We're going to be here. We're going to be here. I'm going to turn you. Just relax. Easy. Both arms. Just going to hug yourself. Take a deep breath. I'm going to do a little push. Breathe out. Just drop. Easy.
Yeah.
Not so bad. Come sit up. Alright, so relax. One sec. So you're gonna swing your legs to your left. You're You're gonna sit here. Good. And what after you're gonna hug yourself.
Okay.
And then you're gonna rotate to your left, and you're gonna go down like that. So I'm gonna scrape these muscles for you, okay?
Okay.
Round 2. Good. All your left, and go straight down. There you go. This is just gonna help to kind of loosen up the muscle, take some pressure off. It's gonna increase the blood flow to the area, break down some of this tissue for you. Alright. Builds character.
Take a little bit.
Yeah, as it should. I feel like we should just have a camera in your face next time. We're gonna do the same thing on the side. So you can hug yourself. Perfect. Just like that. More seconds.
It's really insane when I do tweak my back how it just feels like my spine turns into concrete and I just can't.
Sometimes you pinch like a little nerve, it'll cause everything to sort of seize up on you. Leave yourself here. You're gonna use the roller table, roll out, and then. So the whole point of this table is gonna start in your low back. It's gonna go all the way to the base of your hips and come all the way back up. The whole point is just since you're a little bit stiff in your hunch, it's gonna push you into extension and compensate. That should feel pretty good. One job, close your eyes, relax, let it do its thing. You'll be here for like 5-6 minutes.
Sounds good.
So what does your like social life look like? A lot of people follow you, they love you, they know, they see what you do every day, but people don't really see what you do outside of your practice. So like, what do you like to do? Bars, restaurants?
Honestly, I like to get out of city town.
Okay.
Home upstate, I like to get out, country life and just relax.
Where?
It's like an hour and 10 minutes north of here, called Carmel.
Oh, okay.
Honestly,
Because I'm from Albany, that's why I was
Yeah.
wondering.
I've never heard of these towns, so I bought a home there, but it's just, I like to be out, sit on the lake, drink with friends, relax, nothing
What
weird.
is it, horseback riding?
Honestly, just take the dog and run the country, it's good.
Why
But,
would you?
I hear upstate, I think
I was
like
gonna
a
say fishing.
empty field.
I'm sure there's horse
He
somewhere.
like hits
Yeah.
barely, he doesn't leave the city unless it's like Miami or Vegas or something, so.
Yeah,
his
for sure.
idea
I used to
was-
stay in here a ton, now I'm just, all I want to do is get out of the city once I'm done working. for
Yeah,
sure.
so you go, like, you'll leave for like a weekend or something?
Yeah,
Okay.
Friday
cool.
night, Sunday night for sure.
Oh, so you're out every weekend?
Most for sure, yeah. I
Okay.
mean, during the week, I shoot a ton of patients, I'm exhausted, and
Yeah.
so I don't go as much as I'd like to, but I save it up for the weekend, which is good.
Yeah, that's interesting. What what is your favorite type of food, like restaurant, places to go in the city?
It's funny, my favorite restaurant is this restaurant called Q, KYU, it's on Lafayette, and it's like,
You heard it?
I would say it's like
No.
an Asian barbecue, but like upscale
Sounds
at
like,
least,
yeah.
it's like my favorite place to go. He's one of my patients, his name's Chris, but now we're ridiculously good friends, and he's the executive chef there, and I go there as often as I can, and now he's opening a bunch of different restaurants, but it's a staple for me, it's one of my favorite places to go.
A question that I just remembered, if someone is in recovery in terms of like physical therapy, could they also come to you as well?
For sure.
Instead of doing the physical therapy where they're sitting there and just
So,
not doing anything?
Every profession has their own part.
Okay.
If you tear an ACL, you need rehab, chiropractor is not the right person, physical therapy should be the person.
Okay.
If it's more of like a musculoskeletal condition where it's not so much fixing fixing something that you tore or something like that, that's where chiropractic puts it in. So I work side by side with a ton of physical therapists where we have mutual patients that where they're doing range of motion, restoring your frozen shoulder, and I'm adjusting the joints around it to kind of help with mobility. So I kind of work with tandem, but we keep in our own lane when it comes to that aspect.
Okay. What do you say to the people that are deathly afraid of coming to a chiropractor? They all the time are like, I'm not getting my neck adjusted, I'm not getting my back.
Honestly, we see like 30 to 50 new patients a week, and it's one of those things, I would say more than half have never been adjusted before, and every